Let's go to the phone lines and speak with Catherine in Smyrna. Catherine, you're on WSB. How are you today?
Good morning. I'm great, Belinda. How are you all?
Terrific. Okay, tell us what's
Good.
going on.
Yeah, thanks for taking my call. I am also, like you, a successful candidate on GLP-1. I started about 4 months ago and really had about 25 pounds to lose, so not quite as much as some patients,
Yeah.
but I have hit my goal as of Friday.
Congratulations.
I feel wonderful. My exercise, my eating, all of that is just at its prime. But my question is, what's next? You know, I'm kind of scared to go off it. I heard you say, Belinda, you've been on it 2 years. Is it safe to stay on it? I just wasn't sure kind of what was going to happen next.
Mm-hmm. Okay, Dr. Herringer.
So really, these medications are meant long-term, if not lifelong. And I do tell my patients, get ready for a 2 to 5 year commitment or lifelong.
Okay.
A lot of our studies right now, they don't really support coming off the medication because there's a lot of weight gain. But also, if the patients don't gain weight back, there's also the metabolic benefits they've gotten. So if their A1C gets better, their cholesterol gets better, their blood pressure gets better, that tends to go back to where it was before the medications. These medications are totally fine to be on long term. We naturally have GLP in our body. It's already there, but for whatever reason, some people have less than others, or some people start to lose GLP and they just don't have as much anymore. So these medications are safe. They've been around over 20 years. Victoza and Saxenda were some of our first ones, so we do understand kind of long-term effects. And if anything, we're seeing the long-term effects are actually pretty beneficial.
Yes.
There's lower rates of cancer because you've got lower rates of obesity. And there's even some studies that have come out recently saying that patients who do have cancer on GLP-1s have less progression of their cancer than compared to patients who don't. There's really
That's huge.
Yeah, there's benefits with eating better foods, lower rates of colorectal cancer, likely coming from just eating better foods. So there's a lot of benefits to them.
That's so good to hear, and you bring up a thought. So I'm due for my second colonoscopy in, I think, November, and they've been asking me to get it on the calendar, and they said I need to be off GLP-1 for 2 weeks prior. So do you just, I mean, of course, I will speak to my doctor about this, but do you just stop at, 2 weeks and then do the procedure and then just go back on? Like, is that safe to abruptly do that?
It is. No more than 2 weeks, but you can stop for 2 weeks and then go back on.